Hi everyone, I'm back with part two of interview with Robert Costiera. He's the physical therapist that gave us all this information last time about neck and shoulder pain and what to do about it and things that we need to look out for. So I wanted him to come back and talk to us about back pain because honestly, everybody complains of back pain at one point or another. So Robert actually owns a outpatient clinic. He has his office is in actually Howard Beach in New York. It's called OrthoFlex. So people who are local to us, everybody's always asking me for a good PT. Now and you'll get to see him. So that way you get more information, firsthand. I am going to get him on so he can actually get started and give us more information when it comes down to back pain. And then we can talk to him a little bit more about his office as well. Hi, Robert. How are you?
How you doing, Fareen? How's it going?
I am good.
All right. Nice to see you again.
Yes, same here. I'm super excited. We learned so much last time when you talked about neck and shoulder pain. And now I wanted to, work our way down like we discussed last time. So now go to back and, take it from there. So if you can maybe give us a little bit about what is back pain and what is it that you see in your outpatient clinic? Patients coming in and stuff.
Lower back pain is probably one of the most common diagnoses that we probably see in outpatient physical therapy. I think probably 7 out of 10 Americans in the United States, sometime once in their life, suffered from lower back pain. So it's a very common issue. I see all types of conditions. I see chronic lower back pain localized to the area. I see arthritic changes in the elderly population with spinal stenosis, which is a narrowing of your spinal canal. I see the younger generation with herniated disc, with radiating symptoms down into their legs. I see sciatica. I see spondylosis, spondylolisthesis, all these types of medical terms, and it's so hard to discuss and differentiate between all of them. But as you can tell, it's a very common issue that PTs across the United States treat, and very common, every day in our clinic.
The ones that actually make it into the office, because the problem is a lot of times the doctors don't write them prescription to come see us first. So they go through everything and then finally are like, wait a minute, maybe I should go see a PT.
Well, that is true. I do see people post-op, spinal fusions, laminectomies, microdiscectomies, people with epidural injections, pain management, nerve ablation procedures where they burn the nerve and deaden it. So there's a lot of useful things out there that pain management doctors and orthopedists are doing. But, it's always good to see a PT probably prior to actually going and getting all these procedures done. Non-invasive is the best way, and physical therapy is the way to start.
When I used to work in outpatient clinic, even pre-surgery, people will come to us. Because even if they were scheduled to get a surgery done, they will still come to us and we would do the treatment to kind of get them to that level where post-surgery was better for them and the results were better as far as their, recovery was concerned.
That is true.
So at one point, guys, whether it's, you're looking into getting surgery done or not, at one point you need to go see a PT. Like it makes such a huge difference because we've had patients who will like come in with severe back pain and then, be able to not get back surgery. Rob, what is it that you have seen as far as back surgeries are concerned? What are the results? Is it still like 50-50 or has it gotten better?
I always say sometimes patients don't really have a choice, but that's very rare. I feel, somebody with an acute herniated disc, what I always tell patients is you really have to give it time. You got to be dedicated. You got to come in 2 to 3 times a week for about 6 to 8 weeks. Yes. You can't just expect after 2 or 3 sessions that you're going to be normal and, and back to where you were. Yeah. So patients sometimes, dealing with a back issue, I've been a back patient myself, so I know exactly what I'm talking about when it comes to this. You feel like sometimes you can be desperate because back pain is very severe at times. And, if you're walking around with like a herniated disc and you kind of shift it to one side, you're trying to get that disc to, relocate. So manual traction could help sometimes with that. Different types of, ICE, electric stimulation, spinal stabilization training, core strengthening. Definitely stretching a lot, a
Yes.
lot of lower extremity stretching, the iliopsoas, which is your hip flexors, your piriformis muscles, your hamstrings. Those are the most important muscle groups to really focus on when you're treating a back patient. And then you have to
Can you give us a list of maybe the muscles that you work on strengthening, and then a list of things that you usually tell people that need to start stretching? So we'll get a list of at least basic, but still, again, guys, you should go and see a PT. Like, don't just start doing everything on your own if you have back pain, because the therapist needs to tell you what's the right exercise for you and what's not. But at least this way you'll get an idea of what you're looking into when you go see a PT, if they're giving you the right information or not, at least.
Well, the first thing you got to focus on is your core, your abdominals, your gluteal muscles, all the muscles that stabilize your hip and your back. So you never just focus on your lower back. You got to focus on all the muscles from above and below. So I do a lot of hip flexion, pelvic tilts, crunches, reverse crunches, abdominal bracing, depending on what their condition is. And either you have to differentiate between whether or not you want to start them with a neutral spine mechanics, which means that you don't want to do any excessive flexion or extension because it could kind of flare them up. With your spinal stenosis patients, you want to definitely focus on flexion, because anytime they walk or they stand, the number one complaint you'll hear is, my legs feel heavy and my back feels fatigued. So you'll see that patient standing in forward flex because they're trying to open up their spine a little bit to take pressure off their lumbar spine. So their abdominals get weak, their hip flexors get weak, their gluteals get weak. So these are muscles that you have to, basically strengthen to get the patient back.
To be.
Yeah, and with herniated disc, I always start off with neutral, and during my my evaluation, I'll try to see whether or not are they extension biased, are they flexion biased, and if anything kind of like triggers them or flares them up, I keep them everything neutral in the beginning. As a clinician, you have to basically decrease the inflammation, work in their pain tolerance in the beginning. So that's when your modalities become handy. And then from there, as they're getting a little bit better, for instance, if they have pain going down into their calf muscle and the pain starts moving closer up towards the spine, that's a sign that the nerve is actually starting to heal. So that is when basically you can become a little bit more aggressive, but not too aggressive. You want everything to centralize to the back. Once the pain is localized to the lower back, that's when you can really start working on their exercise program, get them back into cardio conditioning, elliptical machine, recumbent bicycle, different stretching techniques. The most important one that I recommend is definitely hip flexors. That's like key, because you see a lot of tightness with the hip flexors, the piriformis, with your hip muscles and your buttock. That's where your sciatic pain can come from.
Yes.
So there's a lot of things that you could do, but you have to kind of, in your evaluation process, you got to decide whether, how aggressive you want to be in the beginning. If they're in that acute phase, you got to go very slow and just, have them come in. If they're on that 6-day steroid pack, anti-inflammatories, maybe 1 or 2 epidurals. Sometimes people need 3 epidural shots, which they'll do in about a 6-month basis. In desperate situations, they'll have that nerve ablation where they go and deaden the nerve and they'll come in. Sometimes it works, sometimes it doesn't.
Right.
But there's a lot out there. But
there is.
Physical therapy, as always, like I always tell patients, is key.
No, you're right. There is a lot out there. That's why it's kind of good to know what kind of options you have, and then you want to make sure you're at least, like you said, you want to exhaust everything before you go in for that surgery, or you want to keep getting these shots over and over again. You want to exhaust everything else out there, because once you go down that route, then it gets even more difficult. Another thing, Rob, I've always done for when I was working, at least in outpatient, and now when I'm working with the younger population, is the home exercise program, like we talked about last time, right? So how important is home exercise program for back patients? Is that once they're done with PT, are they done, or you really then tell them that, no, this is a condition that you need to keep working on throughout?
Well, I always feel that the home exercise program is key. So I usually give them 1 or 2 things to do when they first leave the office after their initial evaluation. I usually do a full treatment with them. And I want to know if there's anything that flares them up. So for instance, if they're in that acute pain, I'll teach them abdominal bracing. I'll teach them how to log roll, getting in and out of their bed, how to transfer properly, just some posture modifications when they're sitting, maybe use a pillow in their lower back to kind of cue them to sit up upright and not slouch, especially with your herniated disc patients.
Yes.
The sitting will flare them up tremendously. Standing exercises with patients with spinal stenosis, I'll teach them how to maintain a pelvic tilt. So this is something you can look up on the internet. In standing, if they do a pelvic tilt and they flex their hips up a little bit, you'll see it'll take a lot of pressure off their back, and they'll have less pain in their lower back, and they won't feel that heaviness in their legs where they sometimes, they say it feels like cement trying to walk. So, and then once they, get at it at acute phase and a subacute and more chronic, then you can become a little bit more, aggressive. A single needed chest stretch, a double needed chest stretch, piriformis stretching, hip flexor stretching. Then I'll teach them some crunches, reverse crunches, abdominal crunches, some spinal stabilization training, mini wall squats with a physio ball behind their back, maybe a little lunge with some shoulder flexion and working on their core to maintain, good proper mechanics when they're doing it. And then just kind of working on their cardio endurance too, because what happens is a lot of these elderly patients, they're sitting home, they're in agony, they're popping pills, they're going for epidural shots, and they don't want to move because they're actually scared.
Right.
So once you get them out of the acute phase and then at subacute and chronic phase, you can become a little bit more aggressive with them, but teach them properly, maybe add about another, say, for instance, if they come in initially, you give them 2 exercises, now they're doing 3 or 4 or 5, depending on how they're feeling. And when they come back and they're giving you feedback, that's when you know how they're progressing.
And honestly, guys, this is the key. I mean, you heard him talk about all these positional changes that he teaches his patients depending on what diagnosis they have. So not all back pain is the same thing. Like, this is what I want you guys to understand. You probably are hearing words that you don't understand. That's fine. That's not a problem. The thing is, what you need to understand, he's explaining back pain is not just back pain. There's a lot of different types of back pains you can have, and you need to get it diagnosed properly to get the proper treatment, because each one of these things needs something different. And you can have that immediate relief just by switching some of your the physical aspect of how you're standing, how you're sitting, some positioning can actually relieve a lot of this pain. So you don't need to keep popping pills just to survive until you go see your doctor the next time. If you go for a therapy session, a lot of these things will be addressed. So this is why I wanted to talk about back pain, because when we are talking about back pain in layman's term, people think back pain, my back hurts, what are the 3 things I can do? There's 100 things you can do. It depends on what is it that you need. This is why I know I keep repeating myself, because it's so important, because you can look up exercises online for back pain and then come back and be like, well, it didn't help me, or it got worse, because you were probably doing it for something that was not the problem that you had.
For
This
instance,
is why. Yes.
I'll give you an example. I have a patient in her 70s. She's got MRI comes back with moderate to severe spinal stenosis, which is a narrowing of your spinal canal. And the number 1 rule is we always teach, don't ever do extension exercises with stenosis. So she's in a yoga class 2-3 times a week, and she's got this flared up leg pain, which is throbbing now. It's getting worse and worse and worse. So I'm like, so what are you doing in yoga? So she tells me, I do these prone press ups until full hyperextension, and I hold the pose for like a minute. So basically what you're doing is you're pinching that nerve even more and more and more, and it's just getting worse and worse. So I said, listen, don't do any extension anymore. So I went over some stuff that she could do in yoga, because she still liked to participate in it, and then didn't want her to stop it. So now, 2 weeks later, she's like, I don't have any leg pain anymore. Oh. So it's just educating your patients properly. And like you said, there are so many different types of back pain. You actually have to see what age bracket that your patient falls into and kind of define how to treat it appropriately.
You're so right. Because when I'm doing yoga classes, if depending on what age group is with me, because usually I'll have 20s to like almost 70s. And I literally, before I start, I'm like, listen, anything starts hurting, you have to tell me. Whether it's your knee pain, it's your back pain, whatever it is, you tell me so I can make adjustments accordingly. So that is definitely important. And then if you guys are doing certain exercise, you need to speak up. You need to tell somebody, you need to make sure that you're doing it properly, because a lot of times we hurt ourselves because we're trying to be healthy.
No, that is true.
So that's why, but that's the case. Rob, I wanted to ask you, a lot of people, when they hear the word herniated disc, it really scares them. So can you maybe give us a little bit information about what is herniated disc? Like how do we need to be scared, or like where should we go if you get diagnosed with herniated disc?
Herniated disc is a very common problem. In severe cases, I dealt with an issue too, where I had a lateral shift, which that means is that you can't straighten up. No matter what you do, you're in absolute agony. You have radiating pain, usually down one leg. You could have numbness, you could have tingling, you could have burning, you could have shooting pain. Sometimes your leg will feel like it's on fire. So what you got to do in a younger population is when they come in and they got that shift, you got to correct it first. So you have to try to, and there's different techniques that you can do. Positioning could help. I do like a lateral shift correction. And what you're trying to do, the number one key is number one, try to get the disc back into place. So the disc basically is like, just think of like a jelly in a donut. Okay, and you get a jelly donut from Dunkin' Donuts. You squeeze the donut, you see that jelly coming out. Well,
Yes.
that jelly is coming out backwards out of your spine, and you got the nerves in your lower back, which correlate to different parts of your. I'm sorry, the nerves correlate to different parts in your legs. So I'm just trying to speak in layman's terms here.
Yes, yes.
So the most common is the L4-5, L5-S1, and the two lowest portions of your spine. So you'll have the pain in your buttocks and the side of your leg all the way down into your calf, on the outside of your calf into your big toe or the outside of your foot. So number one, reduce the inflammation. Okay, try to get that gelatinous material back into the disc area to try to heal the healing process. Ice, anti-inflammatory, soft tissue massage, core strengthening, all that stuff that I just spoke about before. So that's a herniated disc. And then usually you can see that in an MRI in the elderly population as well. But you mostly see like arthritic changes, facet problems, stenosis. So there's so many different areas to look at, and imaging could help you. But I always say if you do a good subjective exam and then you do your physical exam, you'll actually know what's going on with the patient and how to treat them appropriately.
You're absolutely right. So guys, just don't get scared when you hear certain terms. If you get a result and they're like you have herniated disc, like Rob just explained, it is something that you can work on. It's fine. It's not something to be scared of, but you do need treatment. You need to get the treatment, and it might be something you have to just keep doing. Like, how we were talking about neck and shoulder pain. There are exercises you need to keep doing because you need to relax your muscle, because that might be the place you're carrying your stress. So the thing with herniated disc also, you'll have your exercise program, you'll have a report with the PT. If it acts up again, you know what to do. You're not, like you will have the steps to take care of it. But definitely, thank you so much, Rob. This was very informative. It's awesome because what I wanted people to know is when you say back pain, it's not just one thing. It's not just something you can go Google and look up exercises to do for strengthening or stretching. For some people it will work, but for some people it won't. It's because you need to go see somebody.
I totally agree. You have to, number one, you have to have a good doctor.
Yes.
And that refers you to physical therapy and works with your therapist. And like in worst case situations, you may need that epidural shot. Yes. You may need a steroid pack and take some medications and stuff, which a lot of people are against. But what I would always say is the number one thing is try to avoid surgery. That's the last resort. Usually what I see, patients that have surgery are usually worse off in the beginning. They do better over time, but it takes a lot of time to heal. So I really think that if you're going to put the time in anyway, you might as well, before you have surgery, do the physical therapy first.
Yes. Honestly, in my experience, Rob, what I've always seen, it was a 50-50. It either worked or it didn't. And then the patient was so much more angrier because now they went through all of this and the pain was still there.
Well, I have patients. I have a gentleman right now that's had 3 spinal surgeries. So, he's thinking about a 4th one. And I'm like, are you absolutely out of your mind?
Yeah.
Don't do it. I mean, it's not helping you. It hasn't helped you the first 3 times. What makes you think that, the 4th time you're going to get lucky? So he's been coming in for therapy for a couple of months and he's feeling a lot better.
That's it. That's the key word right there. What he said, guys. This is what you need to focus on. So, like I told you guys in the last video, when you have neck and shoulder pain, you know what? Go see a therapist. Get the information correct. Get what you need. Get your treatment done for a couple of weeks, 4 to 6 weeks. Get your home exercise program so you can take care of your issue yourself. Same thing with back pain. The reason I wanted Rob to come and talk to us about it, because as you can see, back pain is not just back pain. There's a lot to it. What makes your back pain special is specifically for you, and that needs to be diagnosed properly so you can get the proper treatment. So thank you so much, Rob. I really appreciate you taking the time out and talking to us about back pain. This was extremely informative. Like I always learn also. So I'm so glad you were able to talk to us so I can, refresh a lot of the things and learn actually new stuff that's out there. Thank you so much. And, if you're up for it, I would love to have you back so we can now talk about the lower extremities, the hip.
Whatever you like, Farine. My pleasure. I have a nice time doing this with you.
Yes. So, we started from the head. We got to go all the way down to the toes.
We'll do knee, foot, and ankle.
Awesome. So, guys, look forward to part 3 of this interview. Again, thank you so much, Rob, for taking the time out and giving us so much information. We really appreciate it.
You have a nice evening. Take care.
You too. All right, everybody. Until next time. Take care.
Bye-bye.
Bye.